Well, I want to go over this blood electrification a little bit better because I saw there's over the years I've looked at what people said for feedback on this, and I don't really know because I don't have any I'm not a doctor. I don't have any patients, and I haven't tried this out where I said it doesn't work, doesn't on myself or not. I don't know. I just do it as a everyday thing pretty much anyway. But I want to point something else out. For one, Dr. Beck recommended using the same wrist, right? You put the two electrodes over the same wrist. I think that's not a problem. Actually, I use wrist to wrist, and Dr. Beck did both. Dr. Bob Beck, who was a PhD, a physicist, not a real doctor, not a medical doctor, but a physicist, right? Well, my point on this is actually let's make sure that if somebody's going to use this procedure or try it out or experiment with it or research with it, that they are doing it towards the correct specification. So in other words, I made 2 red marks on my wrist where my vein and artery is, and you can feel the pulse, and there it is. So if I did not do that and I decided to put this here or here, and guess what? I missed. I missed where the blood flow is going because this has to penetrate through skin and fatty tissue to get into the bloodstream, and then it has to be at the right intensity per the patent to work, correct? So, it's not... So I could see where people could have this off a little bit, and it's not working that much. Now, the other side of this is, you notice these metal strips? These are about 3/16 of an inch wide, and are less than 1 inch long. That's all it is. You do not want these real wide or real long where you're trying to pulse through a larger area, because what's going to happen is it's not going to penetrate directly into the artery or vein. You want this electricity concentrated in one spot, and you want to use these pads like these are cloths. You're not going to have bare metal on the skin because that'll burn. The whole idea is to actually put the electricity in to the artery or vein itself without having to take the blood out and electrify it. You want to do it from the outside of the body. So, when you put this pad over here, you'll have this wet with tap water, lightly saline solution, a little bit salted water, but tap water works fine. And you'll have the electricity going through the metal rod. And since you have the cloth over the skin, it's not going to burn unless you turn it up way high. But you want to turn it up enough so you feel a little bit of pulsing. And on this device, you want to actually vary the current a little bit, because it's a little bit of guesswork if you're getting the exact amount of current in the blood itself as per the patent. You don't know exactly what it's doing. And one thing is, you definitely want to have these electrodes over the correct place. If you're off a little bit or the electrodes are too wide, they're not going to penetrate directly where the vein and artery is. I think this is why there's such a variance between what people say how this works and doesn't work. It seems that most people say it works. And I'm thinking the variance is mainly, it could be, that it's not conforming exactly to specification. Now, this is a unit that's made down in Ecuador by Mike Forrest. Pointed out before, I like it because when you turn it on, you see you have a battery checking light. You can check your batteries and stuff. He also has a light in here to tell you, how much current you're using and stuff. It's pretty good. But even when you're using this, I would vary it so you can feel a little more pulse, because it's like even if you know a certain specification works, how do you know exactly how much electricity is actually going into the bloodstream? Is it conforming to the exact patent? It's kind of really hard to tell, isn't it? That's one reason when you use this, you probably should vary the current. But more importantly, is to make sure these metal strips aren't too big. That's about 3/16 of an inch. You see, it's about as wide as, say, a vein or artery might be. It's a little less than that, but the vein or artery is probably a little less than that, but it's about that width. It's no longer than 1 inch, because you don't want this spread out over a long stretch. You want it concentrated enough that it's actually the electricity is going to get through the fatty tissue, through the skin, and into the bloodstream itself. This may be why there's such a variance between how this works on some people, and some people say it doesn't work well. Now, I don't think there's a problem using the same wrist. I used wrist to wrist. I'll use both, I'll use both. So in other words, I'll put one pad on one wrist and the other pad on the other wrist, right? And electrify that way. But Bob Beck, Dr. Bob Beck, physicist, not MD, physicist, PhD, he used the same wrist. I don't think there's a problem where the electricity is going to jump from here to here, because the resistance, the Ohm's resistance of the skin, is actually quite high. It's not much of a distance to go from the outside of the skin here into the artery itself. But to go from this distance to that distance, I doubt you're actually doing much of that. But I personally do prefer going from wrist to wrist versus the same wrist. But I think both procedures will work fine. But I think the main thing where people possibly err is not having it directly over the artery, and not having this to conforming to specification, which is less than 1 inch and about 3/16 of an inch wide. Or they're thin strips; they're very thin, no more than 3/16 of an inch wide on these stainless steel strips. That may be. And the other thing is, you are kind of doing guesswork as to trying to figure out if you're getting the exact amount of current into the bloodstream per se. So what I would do, I'd vary this current. Where you feel some pulse, you feel kind of a lot of pulse, you back it off, you don't feel the pulse. Vary the current. Vary the current. Because that's probably the difference. I think if you can actually, I would assume that the patent does work fine. So it's a matter of actually conforming to specification. And I think that probably is where the problem lies, where people are getting different results. Bob Beck seemed to get excellent results when he applied this to test people that he was researching with. And it's probably correct. That's what I'm assuming. I think it is correct. So make sure you're conforming to the specification and getting it directly over the vein or artery. You're not using too wide of a metal strip or too long of a metal strip. And you're varying the current, and you're using the exact parameters that Bob Beck said to use. So it should work, I would assume.